Intestinal infections like candida, parasites, and bacteria cause a constant chronic stress on our system, which burdens our adrenal glands, raises cortisol, increases inflammation, and this further can disrupt thyroid function. So estrogen dominance is a problem that can be seen with dysbiosis, so we'll talk about estrogen now. So intestinal yeast, overgrowth of yeast can produce estradiol, and this can raise estrogen levels and cause increased symptoms of premenstrual syndrome, bloating, breast tenderness. Intestinal bacteria also disrupt the process by which estrogens are excreted in the liver. We'll talk about this in a further slide, and cause these estrogens to be recirculated. This again will increase symptoms of PMS, bloating, breast tenderness, but also can cause anxiety and insomnia. We know that natural progesterone often alleviates these symptoms and can really help the problem and improve quality of life. Now, sometimes you can have a paradoxical effect. When you give progesterone, you can feel worse, and this really points to the fact that there is a pretty bad yeast problem, a yeast syndrome, and this gets better with time. Excess estrogen can also suppress thyroid hormone function because it binds to thyroid hormone receptor sites, so it makes thyroid less active, increased estrogen. So we'll talk about hypothyroidism and dysbiosis. Intestinal immune reactions, such as those caused by leaky gut or infections, causing inflammation, raise inflammatory cytokines. Inflammatory cytokines can disrupt our brain function. We'll talk about how they can cause depression, but they can also cause central hypothyroidism. A few words on central hypothyroidism is when the TSH, which is secreted by our brain when our body needs more thyroid hormone, is not secreted appropriately because of the inflammation. So that the TSH, you don't see the typical rise you see in the TSH. So this can be a problem, especially with routine diagnostic testing, because it will not, if you routinely just test for TSH, as done traditionally by some doctors, you would not pick up on this problem. So you can actually even have a suppression of TSH when the body has a need for thyroid. So it's kind of like the opposite would show on the blood test in terms of TSH. So you really need more appropriate screening and thyroid tests to diagnose this problem. Another way you can cause hypothyroidism with dysbiosis is decreasing the conversion of the active form of thyroid got a note, sorry about that, is decreasing the conversion of T3 from T4 in the liver. So this would decrease the active form of thyroid and cause symptoms of hypothyroidism. Another way we can get hypothyroidism is by gastrointestinal imbalances like infections causing a stress response, increasing cortisol levels, and those will suppress thyroid function by decreasing T3. Dysbiosis also causes a progesterone deficiency, and that can also cause increased symptoms of PMS. So last webinar, we talked about some of the functions of our friendly bacteria in our intestines, and these are digestion and synthesis of vitamins and a prevention from colonization by pathogens. But we'll focus on the next slide on this liver recirculation of hormones, and our friendly bacteria have a role in this important function. And this may get a little detailed, but just do your best. So beta-glucuronidase is an enzyme that's produced by bacteria. Usually our liver is what detoxifies estrogens in men and women. Estrogens have a function in our body, but when we're kind of done with that cycle, we have to excrete them in our liver. Otherwise, metabolites can actually be carcinogenic. So beta-glucuronidase, which is an enzyme that can be overproduced by bacterial overgrowth, blocks this process. This can be seen in inappropriate diets or diets very high in meat fat. This enzyme can be lowered with increased fiber and probiotics, lactobacilli, and also certain nutraceuticals. So this is a slide that shows how this works. Our liver detoxifies estrogens through our stool. If we have a dysbiosis and high bacteria in the intestine, this causes an increase in that enzyme, beta-glucuronidase. And this will disrupt this process, not let the estrogens be excreted in the stool, and recirculate the estrogens in the blood. And you can get a lot of the symptoms of high estrogen, PMS, bloating, anxiety, insomnia. It can disturb cortisol and thyroid, but also it can potentially have a role in cancer. This slide talks about the relationship between dysbiosis, our adrenal glands, and cortisol, and hypothyroidism. So at the top, you could see food allergies, leaky gut, and infections, such as those of parasites, yeast, and bacteria, can put a stress in the immune tissue of the intestinal tract. We have something called intestinal lymphoid tissue, GALT, gastrointestinal associated lymphoid tissue, and this can be stressed by the infections. The stress in this area can cause a major stress response in the body, which will raise cortisol. High cortisol disrupts thyroid function, especially the conversion of T4 to T3, so you get lower T3. This lower T3 further puts a stress on our body because there's a higher demand and cortisol gets elevated. When cortisol is elevated, we get further immune suppression in our GI tract, and we can get further food allergies and infections, and it's basically a vicious cycle. So now we'll go on to talk about some of the other problems associated with dysbiosis, and you could see attention problems and mood disorders. So we'll talk about anxiety. Dysbiosis, one of the ways it can cause anxiety is by causing hypoglycemia. Bacterial dysbiosis in the intestine can cause low blood sugar. When you have a low blood sugar state, you get an increased need for adrenaline to drive the blood sugar back up. This can give feelings of anxiety and even panic. We talked about how dysbiosis can cause hormone imbalance, usually low thyroid, low progesterone, and high estrogen. This scenario causes more likelihood of low blood sugar, which again can increase adrenaline and cause anxiety. It can also be related to depression. One way is that dysbiosis can increase bacteria, again in the intestine, and bacterial cell wall components alter our immune system because they also release inflammatory cytokines. Interleukin 1, interleukin 6, so these are basically inflammatory compounds that can cause depression, anxiety, and impaired cognition, decreased mental clarity. We talked a little bit about this before. Those cytokines can cause central hypothyroidism, and hypothyroidism is related to depression. So this kind of a diagnosis and treatment really needs a high index of suspicion by the clinician. Routine testing does not adequately test for these problems, and you really need appropriate diagnostic testing and a clinical correlation to be made by a specialist. And a word on depression, studies show that T3 can be very helpful in the treatment of the depression, as opposed to treating hypothyroidism conventionally with T4 alone. We don't see the same effects on improvements in mood with the T4. So this slide, I'll summarize it. This just talks about how serotonin metabolism, serotonin is the feel-good hormone, can be altered in dysbiosis. Tryptophan is a breakdown of an amino acid. It goes to 5-HTP, which makes serotonin. If we have overgrowth of bacteria and abnormal metabolism of the tryptophan, instead of making serotonin, we make these other metabolites. So what happens is we have lower serotonin and mood problems, anxiety, depression. and even obesity and weight problems, because serotonin plays a role with that. So there's a clear relationship between the mind and the gut. So again, mood disorders and attention problems can be related to dysbiosis. Autism, 80 to 90% of children with autism have abnormal levels of bacteria and fungal metabolites in their urine. Changes in mental clarity, memory, and learning result from the toxins from bacteria and yeast, as well as changes in our immune system caused by these abnormal intestinal flora. So these have a correlation with autism. Brain fog. Brain fog is very common with dysbiosis. It's very common with those suffering from yeast syndrome. One way that can cause brain fog is dysbiosis. We talked about it. Can cause hypoglycemia. The low blood sugar can cause foggy thinking. Immune system alterations from imbalanced flora, we talked about this, can cause increase in those cytokines, those inflammatory markers, and those can interfere with memory and learning. Hypothyroidism itself causes a decrease in energy in the body. This can cause brain fog. Fungal toxins can cause lower cellular energy and lower cellular metabolism. This can cause brain fog. Elevated levels of ammonia from intestinal bacteria, they can disturb our energy production, and we can obviously feel fatigue, but also foggy thinking. So this is a study with the importance of microflora in autism. Microflora is our intestinal beneficial flora in our intestine. And late onset autism demonstrated significant alteration from normal controls in that they had greater numbers of bad bacteria and absence of normal organisms in the stomach and the upper intestines. So the take-home point is that if we heal the gut, usually the mind follows. There's a close relationship between the mind and the intestines. So other symptoms, constipation and diarrhea, loose stools. A lot of times patients have alterations in these, irritable bowel-like syndromes and dysbiosis. Some of the ways these can be caused is that bacteria secrete methane. Methane decreases contractions in the intestine. This can cause constipation. Bacteria, parasites, and yeast can cause inflammation in our intestinal wall. This can cause diarrhea or just loose stool. Dysbiosis, again, can cause hypothyroidism, like we talked about before, and this can cause a constipation. We all know hypothyroidism is one of the symptoms is constipation. Dysbiosis can result in decreased nutritional and energy state in the body, and this can reduce the body's ability to detoxify. It can alter immune function, and this can alter our intestinal motility and cause problems with loose stool, diarrhea, or constipation. So this connects dysbiosis, leaky gut, and food sensitivities. So dysbiosis can cause leaky gut, that break in the intestinal barrier where large undigested food particles cross the gut lining and can cause overt food allergies. But sometimes dysbiosis doesn't necessarily have to cause a full-blown allergy. It can cause a food sensitivity without an allergy. And I'll just give a couple examples, but there's others. So an example can be harmful intestinal bacteria. They themselves can produce byproducts of casein, which is a breakdown of a product we see in milk. So caseins can release vasoactive amines. They can increase histamine, and histamine can give you allergic type symptoms, hives and things like that, but also can increase migraines. So this is kind of an indirect food sensitivity. Another example can be candida. Candida, among other things, can cause inactivation of vitamin B6. When you have lower vitamin B6, for example, one thing you can't tolerate is MSG, used frequently in foods. You wouldn't be able to break this down. So you would react to foods that contain MSG. So you would be sensitive to those. So dysbiosis is clearly related to chronic inflammation, and Ulcerative colitis and Crohn's are inflammatory bowel diseases seen in the intestines. Usually you need an environmental trigger. You need a genetic predisposition to the problem, and there's an environmental trigger, and this can be an infection or drug like NSAIDs or other drugs. This causes a decrease in the regulation of our immune system, a failure of our cells to repair themselves, and chronic inflammation. So a lot of studies have been done on probiotics and improvements and even remission of ulcerative colitis and inflammatory bowel disease with high-potency probiotics. Studies were done on this very high-potency one called VSL3. Rheumatoid arthritis is another inflammatory condition, very closely tied to dysbiosis, and really all other autoimmune diseases are inflammatory conditions and are related to dysbiosis. So inflammation is basically your gut on fire. And again, we talked about this. For inflammation or for autoimmune disease, you need a genetic susceptibility, an environmental trigger, which can be the dysbiosis or a drug or a toxin that triggers an immune response, and this causes the antigens and the adjuvants that cause the disease. Here we're talking about IBD, inflammatory bowel disease, but the disease can be, for example, autoimmune disease. So this is another slide. So again, you can have a normal intestine. You can have all the things we talked about that cause injury, infections, drugs, non-steroidal anti-inflammatories, which cause acute injury and inflammation. Sometimes you can get healing and tolerance, but other times when the immune system is disrupted and there's a failure of repair, you can get chronic inflammation. So what do we do about this? How do we put out the fire? A lot of studies have been done on probiotics and normal flora, and probiotics in good quality probiotics in high numbers decrease inflammation. Probiotics are anti-inflammatory. Again, recent evidence demonstrates they're anti-inflammatory and anti-allergenic, and we see these in the healthy infant gut. And another important function is that probiotics can be an aid in reversing increased intestinal permeability and leaky gut. So we'll talk about the relationship between Hashimoto's or autoimmune thyroiditis and dysbiosis. This is the most common cause of hypothyroidism, unfortunately not routinely tested by traditional doctors, but it is the most common cause of thyroid problems. It can begin when the thyroid gland becomes more leaky or permeable to increase blood flow into the gland, and substances that shouldn't enter the thyroid, like toxins, do. This is also a sign that the blood-thyroid barrier has been broken down, inflammatory components, white blood cells are entering it, and the immune system can no longer keep up with the damage. This is usually associated with leaky gut, which allows unwanted substances, like we talked about, and toxins to enter the blood. So as the gut becomes more leaky, so do the rest of the body tissues. So here we're talking about the thyroid. It can happen in the brain, the kidneys, and it's important to understand that autoimmune thyroiditis, really all autoimmune disease, it's not a disease process specifically only in that system, but it's really a symptom of a breakdown in the immune system, and can be related to leaky gut and dysbiosis. So this is a study that really highlights that autoimmune processes can be arrested if we can basically rebalance the interplay between the genes and the environment, and this can be done if we can heal and treat the leaky gut, and this can be done using high-quality probiotics. One of the ways it can be done in. So dysbiosis also causes nutritional deficiencies. Nutritional deficiencies can be the result of leaky gut, which causes inflammation, which causes a decrease in absorption of nutrients. We frequently see low iron, low vitamin B12, low folic acid, low magnesium, low zinc, biotin, taurine, B6. I mean, any or all of these can be seen, and these point to the fact that there's a problem in the digestive tract. Either we're not absorbing it right, or there's leaky gut and inflammation. Some of the problems, again, those deficiencies, iron, folate, all those nutrients we have multiple roles in our body, and so you can see anemia as a result of that. You can also have vitamin D deficiency, and that can cause a variety of problems. And some of the causes, again, can be overt celiac disease, but a lot of the problems we talked about, dysbiosis, inflammation, leaky gut, poor digestion. This is a slide just highlighting the potential risk of antacids, proton pump inhibitors. So we need digestive enzymes in our system. So when you block stomach acid, symptomatically, you can basically disrupt the process of absorbing nutrients. So you can get malabsorption of calcium, iron, and vitamin B12. And this can cause, one of the things it can cause is osteoporosis, but it can cause anemia, fatigue. And also when you decrease stomach acid, you're going to get increased overgrowth of bacteria. So stomach acid in our system has been put there for a reason, and basically the reasons are digestion and protection from pathogens. So dysbiosis can also result in a lot of chronic infections. A lot of people have frequent colds and flus, recurrent flus, chronic infections. So this is a sign that the immune system is in trouble. Again, recall that 70% of our immune system is located in our intestines. The microbiota, all those friendly bacteria, or overgrowth of bad bacteria in our intestine affect our immune system. Intestinal yeast and viruses can suppress our cell-mediated immunity. This can increase our susceptibilities to cold and fungal infections, chronic sinusitis, and chronic ear infections. Dysbiosis can cause leaky gut. Leaky gut can cause food allergies. Food allergies, as we talked about before, can cause repeat sinus and ear infections. And so there could be a vicious cycle where you get these chronic colds and flus, and you may be prescribed antibiotics. The antibiotics further suppress the immune system by eliminating and destroying intestinal friendly bacteria, and this can cause more frequent infections. Hives, eczema, skin conditions, and dysbiosis. So mast cells are a type of cell we have, and they release histamine into our skin and blood vessels in response to allergies or chemicals. And so you can get a hive or itching. Poor gut flora increases the number of allergies and chemical sensitivities that we see. Many patients with yeast syndrome experience hives. Leaky gut, again, can cause poor absorption of nutrients. Poor absorption of nutrients, namely some minerals, example, magnesium, has an important role in stabilizing mast cells. So increased intake of, and a note on magnesium, just one thing affected by poor intestinal absorption, but magnesium has a role in over 200 reactions of the body, So here's one of them. Low magnesium can cause increase in allergic symptoms, and increased intakes of magnesium can help decrease that histamine release. Dysbiosis can also cause, like we talked about before, overworking of our liver due to the bacterial toxins and decreased clearance of the toxins. So the liver can't keep up with eliminating the toxins. And then one of the symptoms of this can be eczema or skin conditions. Problems with blood sugar. A lot of patients say, my blood sugar seems to drop. This is related to dysbiosis. Yeast and bacteria produce ethanol, tartaric acid. These are different components that they produce, and these can impair the body's normal production of glucose. So you can see these, a lot of patients, some people have alcohol intolerance, and this is seen in a lot of people with yeast overgrowth, because ethanol is produced by certain yeast, and it inhibits our liver's production of sugar from fat and protein. So you can see an intolerance when patients with yeast drink alcohol. And you can see problems with blood sugar and feeling like you're low in blood sugar and hypoglycemia. You can also see overproduction of other compounds like tartaric acid produced by certain yeasts. This also impairs the body's production of glucose, gives you symptoms of hypoglycemia. This is seen a lot in patients with fibromyalgia. Another way that it can do this is it can cause, like we talked about before, hypothyroidism. Hypothyroidism is a decreased cellular energy state in the body. It decreases metabolism. Decreased metabolism can decrease blood sugar, and you can have symptoms of hypoglycemia, low blood sugar. Insomnia and dysbiosis, excess estrogen and progesterone deficiency. We talked a little bit about those before. And when you have really high estrogen, this can disrupt your sleep, or low progesterone. Increased ammonia. Ammonia can be produced from bacterial metabolism, can break down serotonin. We talked about it a little bit in that slide where you saw how serotonin is made, and one of the side effects of low serotonin can be disrupted sleep. Increased histamine causing allergic symptoms. Histamine can disrupt your sleep and cause insomnia, and low magnesium can disrupt your sleep. Prostatitis and dysbiosis. So inflamed prostate is associated with pain, but most commonly this is not from an infection. This can be misdiagnosed. The pain can be from the bladder, from interstitial cystitis, and we'll talk about this in a further slide. Excess estrogen in men can actually have a role in prostatitis. Intestinal yeast produce the estradiol and cause this in the dysbiosis. This, again, interferes with our ability to eliminate them and cause different symptoms in interstitial and the bladder symptoms that can be mimicked as prostatitis. Find this slide here. All right. So this is a slide on interstitial cystitis and dysbiosis. So interstitial cystitis is a condition where you have bladder pain, but there's no infection. We see that often the symptoms improve with treating imbalances in the gastrointestinal system. Fungal infections must also be considered and should not be ruled out. These are, again, not routinely tested for on a regular urine culture. So a lot of times this can be due to actually yeast infections and fungal infections. And so treating gastrointestinal imbalance a lot of times improves interstitial cystitis. Fibromyalgia and dysbiosis. It's often associated with dysbiosis and also small overgrowth of bacteria in the small intestine, high histamine, like we talked about before, in allergies, immune reactions to parasites. Low magnesium can cause high histamine, poor circulation, high estrogens. This can increase the motility in our small intestine. It can interfere with clearing of bacteria and debris, and this can increase the pain and symptoms of fibromyalgia. Hypothyroidism can also decrease the motility in our intestine, making it slower. This can cause constipation, but it can also cause an increase in overgrowth of bad bacteria in our small intestine. This can also increase pain associated with fibromyalgia. Magnesium deficiency is also seen in dysbiosis and leaky gut. And again, this can increase those inflammatory cytokines, histamine. It can lower glutathione and cause cells to uptake calcium. So a good place to start with fibromyalgia patients, just a word on treatment. Sorry, one second. Yes?
Thank you for holding, everyone. Let me find out if we've got a voice from Dr. Rashel. Give me just one moment, please. Thank you for holding, everyone. We'll be back on track in just one moment. Thank you. Thank you for holding, everyone. Give us just one moment. Thank you so much.
All right, sorry about that. I think we had a little problem with the computer system. Let's pick back up on this slide on fibromyalgia and dysbiosis. So again, it's often associated with dysbiosis, fibromyalgia, and overgrowth of bacteria in the small intestine. High histamine from allergies, immune reactions, parasites, low magnesium can cause this. Poor circulation can cause high histamine, and this causes a decreased motility in the small intestine, which interferes with the clearing of bacteria, which can cause increased fibromyalgia symptoms. Hypothyroidism can also decrease intestinal motility, which can cause increase in overgrowth of bacteria, which is again related to increased fibromyalgia pain. Magnesium deficiency, also seen in dysbiosis and leaky gut, again can cause increase in inflammatory cytokines, histamine, glutathione, and causes cells to uptake calcium more, and all of this can cause increases in symptoms of fibromyalgia. So a good place to start on fibromyalgia treatment would be to, take a good look at mineral balance, magnesium, hormonal balance, thyroid balance, diet, and restore the integrity of the intestine and detoxify any bad bacteria and toxins. Yeast syndrome and dysbiosis. Intestinal yeast secrete an enzyme that digests the lining of the small intestine. Yeast shift our immune system, overgrowth of yeast, from Th1 to Th2, which increases the likelihood of allergies and viral infections. Yeast enzymes break down a secretory IgA, which is a very important antibody covering our gut mucosa, which keeps toxins and bacteria from binding to the cells. So having lower numbers causes the intestines to be inflamed. And we can actually test for this. We'll talk about this in the testing section. Yeast also secrete metabolites of yeast metabolism, like arabinitol, acetaldehyde, tartaric acid. These interfere with mitochondrial energy production and obviously can cause fatigue, lower energy, and many other symptoms. Yeast can cause reduced levels of amino acids, fatty acids, deficiencies in other nutrients, vitamins, minerals, B6, folic acid, alpha-lipoic acid, coenzyme Q10, taurine, and others. It is possible for yeast to be present in the small intestine and stool with a negative stool culture. So even with a negative functional stool test, they can be damaged and not grow in the culture. So it's important to have a clinical correlation as well and have a history. So if there's a history of antibiotics, birth control pills, stress, and some symptoms, bloating, some of the symptoms we talked about, we may want to go ahead and treat this problem. So now we'll talk about diagnostic testing and functional stool testing, which is different than routine stool tests done for blood and parasites. Sometimes the traditional doctors run. Functional stool testing is different. It gives us way more information into what is going on in the intestine and some of the things we talked about. Blood testing is important, but you need to assess appropriately for hormone imbalance and deficiencies in hormones, nutritional deficiencies, like the ones we talked about, antibody levels, perhaps the candida, and food allergies, but with the appropriate, with IgE and IgM antibodies. You can also do urinary and blood metabolite testing, where you test for metabolites in energy and bacterial production. So that can tell us if there's a problem with our mitochondrial energy production and with different types of bacteria. You can also do a breath test for small intestinal bacterial overgrowth. Obviously, radiological studies traditionally done can give us information. Endoscopy, colonoscopy, mostly to end stage, physical disease, but not to functional problems. So this slide says, you're not ill yet, Mr. Blendl, but you've got potential. So it's important to look, at our symptoms early on when they come up before overt chronic disease comes up. So this is an example of a stool test, 48-year-old female, and here you could see that in the beneficial bacteria, NG means no growth. So this person had no growth of lactobacillus. A dysbiosis, so less growth of the other bacteria, and also overgrowth of certain types of additional bacteria. This is a slide. This is another functional test, part of the functional test, that shows your digestive enzymes. Pancreatic elastase helps us digest our food. So if it's low, you're going to have poor absorption of proteins and those immune complexes and leaky gut and increased problems with systemic problems. It also checked for these two calprotectin that we'll talk about in a later slide. Again, another slide showing overgrowth of additional bacteria and inappropriate growth of bifidobacter, but also a high growth of Candida albicans, yeast. This is testing that can be done to show vitamin deficiencies and antioxidant deficiencies. Magnesium here is seen as 0, B12, folic acid, glutathione, manganese, all of which are important in treatment. Another slide, again showing overgrowth of Candida albicans, no growth of lactobacillus, overgrowth of some of these pathogens like Klebsiella, Citrobacter. These can all be in the intestine and not show up on a routine test. So and other tests that functional stool testing can test for are these early markers of inflammation. Two of them are calprotectin and lactoferrin. These can come up high way before you see a full-blown inflammatory bowel disease or colitis, and we can use these as markers to go ahead and start treatment. They're again elevated in inflammatory bowel disease, irritable bowel syndrome, cancers, different problems with non-steroidal anti-inflammatory agents. They can be raised in food allergies, pancreatitis, and they can give us clues as to problems that are really starting to happen in the intestine. So we talked about secretory IgA. So you can, functional testing, stool testing also shows us levels of secretory IgA, and these can be lowered or higher if you have an upregulated immune system, but they're lowered with chronic stress, celiac disease, autoimmune disease, and dysbiosis, you'll see lower levels of secretory IgA. So endoscopy gives us valuable information, basically with cultures and checking for gastritis, and colonoscopy for polyps, and actually seeing overt inflammation in the intestine. So we'll talk about treatment now. So we have the 4R program, and it's a good way to remember. We want to remove bad things, pathogens and food allergies, replace the good things, re-inoculate, bring back and repopulate the beneficial bacteria, and repair any damage. So remove, we want to remove pathogenic organisms that we found. We want to remove allergenic foods that are further causing inflammation in the intestine. Removing the bad is the first step, and it's critical to starting their treating the imbalance. Then we want to replace. You want to replace the digestive enzymes. They have a very important role, but good quality, high quality digestive enzymes for proteins and for stomach acid. We also want to replace hormones, imbalances in hormones, and nutritional deficiencies. We want to re-inoculate, so bring back the appropriate ratios of Lactobacillus, Bifidobacter, Saccharomyces, which is a beneficial type of yeast. So we want to bring back the good guys. And then we want to repair the intestinal lining. We want to repair that leaky gut. And we have a variety of research-based nutraceuticals that can help us repair that intestinal lining. And the 5th R is rebalance. So we want to modify attitude. If we have high stress, if we have inappropriate diet, we want to do things basically a little bit differently to promote a healthier gastrointestinal system and balance. So this is basically the end of our presentation. Let me know if you have any questions, please.
We do have questions for you, Dr. Rashel.
Yes.
And I'm just going to get started, and we can start with, can you tell us what happens, this isn't related to the gut, but what happens with the TSH when one has MS?
What happens with the TSH when we have MS, multiple sclerosis?
Yes, ma'am.
Well, multiple sclerosis is an autoimmune problem. So usually you can have what will happen to the thyroid is you can have symptoms of hypothyroidism. Now, the TSH can be normal, it can be high, or it can be suppressed, like some of the things we talked about in central hypothyroidism. Because if there's a lot of inflammatory cytokines, you can actually have a normal TSH but have a deficient thyroid state in the body.
Okay, great. Now we'll get on to the gut questions. And that was such a great presentation. We appreciate it. Can you tell us if people who have hyperthyroid can have similar gut issues?
Absolutely.
Those who have hypothyroidism.
Yes, so hyperthyroidism also, thyroiditis or autoimmune thyroid problems can begin with a state of hyperthyroidism, where the thyroid is inflamed, and you can actually have symptoms of too much thyroid that can later become too little thyroid. So really, the root of it can be the same as everything we talked about. So they can be related to dysbiosis in all the same ways. And hyperthyroidism can later turn to hypothyroidism by that inflammation in the thyroid gland.
And it's along the same lines with the diagnosis of hypothyroidism of Graves' disease and having allergies. Does the hyperthyroidism, is it having, or the Graves' disease, is it related to having the allergies, or is it just a symptom, or what happens with the autoimmune disease?
With Graves, with hyperthyroidism,
Mm-hmm.
I think a good place to start, when you start to see abnormalities clearly even in hyperthyroidism, is everything we just talked about. Further investigation into toxins in our body, imbalances in the GI tract, imbalances that can cause this. And then we start to treat some of those problems and see if we can get, a little bit more balanced thyroid problems. A lot of that actually can have to do with intestinal barrier function.
Okay, we have a listener that was wondering how pain can be affected throughout their body if they have gut issues. Can they get pain across their chest or shoulders from not being able to digest food or medications properly or having allergies?
Okay. Phone is ringing. All right. So pain in the digestive system I'm sorry, repeat because the phone is ringing. Can you repeat the question?
That's okay.
The phone is continuously ringing. Okay. Go ahead.
The pain was specific, but I'm going to say, can not being able to digest food or having food allergies cause
pain in the stomach pain. So yes, right, definitely. So any type of, let's say dysbiosis or overgrowth of bacteria or food allergies can cause symptoms of bloating, pain and bloating can cause referred pain. I mean, you can have so much gas in the intestine that it can mimic a heart attack. So yes, I mean, it doesn't always have to be to that extent, but it can. So you can definitely get severe bloating and abdominal pain when you're taking in wrong foods that you're allergic to, but also if you have some of the hormonal things we talked about, the high estrogens related to the dysbiosis, those can cause bloating and stomach pain. I think there was a last part to the question. There was another part to the question.
Well,
Jenny?
Can it cause any pain above the, above the gut area, across the chest or the breast, kind of like, yes.
Theoretically, gas pain can be referred and cause chest pain.
Okay.
Yes.
Okay, and one of our listeners would like to know if what they can start at home today. What could they start at home to start to repair the gut?
Okay, if you're at home today, what can you start at? So with no supplements, let's say you're not taking any supplements, then I would start with a diet. I would basically eliminate wrong food intakes, high sugar content foods, and maybe if you're completely out of reach and cannot take probiotics, digestive enzymes, you would make sure you chew your food appropriately. You can maybe add in certain fermented foods, but you have to be careful with that. If you have a really bad candida problem, sometimes that can make it a little bit worse. But I would basically eliminate a lot of the foods that increase sugar and yeast and overgrowth of bad bacteria in the intestine, and stay away from drugs that you don't absolutely need.
And if they were interested after they started to adjust their diet, what supplements would you recommend they start on?
Supplements, I would definitely start with a probiotic. I would start with a digestive enzymes, and those digestive enzymes, they should include enzymes that break down protein. And again, this is about those immune complexes, that if you're not digesting right, you're going to get more immune complexes and can cause distant organ damage. So you want to have enzymes that break down protein, and you want to have enzymes that have perhaps a small amount for some people or more for others, stomach acid, so that you can get rid of, you can digest your food appropriately and get rid of any bad bacteria. And also, you can actually start on basic botanicals that can be broad spectrum botanicals that will treat overgrowth of some yeast and bad bacteria. I would also use just a powder of some sort. We have Gut Feeling Max, for example, that has a lot of the anti-inflammatories and high-dose L-glutamine and all of the things that are reparative and a decrease in inflammation in the gut and help repair that intestinal lining.
Great, and we'll have time for one last question with you, Dr. Rashel. Would you recommend or do you suggest for probiotics, probiotics every day for the rest of one's life? And also, do you recommend them for children?
think we had this last time too. I think I do recommend probiotics for children. Studies show that they are definitely not harmful, and many studies show that they are helpful. Should you take them the rest of your life? I mean, if you want to prevent and kind of healthy age, yes. But if it all comes down to your symptoms, what are you feeling? If you have a problem we're trying to treat here, and we're trying to hit it at the root of the problem, and you're one of those people like me, for example, who've had, a lot of antibiotics, a lot of different kind of things that have disrupted the gut lining, I probably will take them the rest of my life because I really want to rebuild that integrity. So it's really, depends on your symptoms, depends on how you're feeling, and depends on your goals.
Well, Dr. Rashel, we want to thank you very much and thank all of our listeners for joining us today for our series. And Dr. Rashel on Heal Your Gut. It was very good information. And for everyone who was on, if you didn't get to listen to the whole presentation, it will be posted on holtorfmed.com. It will be posted tomorrow. And stay tuned for next month. We will be having Mary Showman and Dr. Holtorf on August 30th. On a presentation on thyroid. So again, thank you for Dr. Rashel for your presentation. We appreciate it.
Thank you.
Thank you, everyone, for joining us. Bye-bye.
Bye-bye. Thank you.